My name is Sharon Hamilton, and I'm a board-certified pediatric dentist. We're at Hometown Children's Dentistry in Ivyland, Pennsylvania. We're treating children ages 0 up until age 18, and my dream is to really provide a service that is not cookie cutter. So I want to treat each patient individually and address their individual needs. I also want to promote a feeling of home and family. I want you to walk in the door and I want you to know us and I want to know you. And I want to make it easier on the patients and also on the parents, because the parents come in and they're very nervous about how their child is going to react to being in a new situation and maybe even a stressful situation. So I want them to walk in and feel like, oh, these people are going to take care of me. The special aspect of it in pediatrics is that you need to manage their fears and behaviors. So you have to be able to know how to get on each child's level. So the goal is to kind of assess what that child may need without causing them a lot of fear and making them feel okay about coming back. I like being a pediatric dentist because I can be myself when I come to work. I can just be me, and the kids like me anyway. They laugh at my stupid jokes and they seem to have a good time. And even if they're older teenagers and they don't act like they laugh at my jokes, they're laughing inside, I know it. From the moment they walk in the door, we want to make them feel welcome. So we address them by name, say hello to them. They can play Pac-Man, or if they're small, they can play with our lunch truck. And then when they come back into the treatment areas, we do a lot of tell, show, do. So before we do anything to them, we show them what we're going to do. I have some stuffed animals that we look at, and I maybe count the stuffed animals' teeth and count their fingers. I show them some of my instruments and try to get them to feel comfortable and not just kind of ambushed as coming in and seeing all this equipment and, oh my goodness, what are they going to do to me? To know that they're walking in and everything's unfamiliar, so they need to be shown, just like with anything else with kids. If they don't know what's going on, then they get anxious and they tend to shy away from things. Part of the reason why I wanted to be a pediatric dentist is because I went to one when I was a child. I had an accident. I fell down and broke a couple teeth. And my mother took me to this pediatric dentist, and he was so nice. I just remember thinking he was just the nicest man I ever met. And he would tell me I was the best girl. And I really was proud that I was the best girl. It really hit home. It stays with me that it's so important what you say to somebody of any age, because I was probably 8 years old and I remember being the best girl, and it meant a lot to me.